And we're going.
This is Channel 5 News. We are here with some Ball State students, and they are going to host a Q&A discussing mononucleosis. So I'm going to give it over to them.
Yeah, so we have seen an uptick recently in the mononucleosis cases, mostly in adolescents and teens. So we just wanted to come on today to spread awareness, talk about the signs and symptoms and how it can be prevented, just to educate the community.
Well, thank you guys so much for being here.
Thank you for having us.
Thank you.
So to start, what is mono?
So we have this helpful little handout right here that we brought along. It's going to have all sorts of helpful information that we're going to go over today.
Okay.
But I'm just going to start off by talking about what it is.
Yeah.
So mononucleosis is a viral infection and it is caused by the Epstein-Barr virus. Like she said, very common in teens and adolescents, but again, we still see it in children. You might often hear it as the kissing disease, very common, and this is because it is spread through saliva, sharing drinks, through blood, sharing utensils, toothbrushes, and things like that, and other bodily fluids. This disease is not very serious, and it's not very life-threatening, but you can be sick and fatigued for about a month or so.
Okay.
And once you do have it, it's unlikely that you get it again, but it is not impossible. So that's
Okay.
something to keep in mind.
Okay. And how do they diagnose mono?
So with mono, you're going to go to your physician and you can talk to your physician about your symptoms you're experiencing, and they'll ask you questions about that. They will also probably feel your lymph nodes, see if they're swollen, feel your spleen and your liver. And then there's also an antibody test that can be done.
Okay. So what are some signs and symptoms of mono?
So the typical signs and symptoms are sore throat, fatigue, fever, body aches. You can also have a swollen spleen or swollen liver, lymph nodes, or tonsils. The swollen spleen is something that is very serious. So when you have a swollen spleen, if it's not treated, it can rupture. So
Okay.
during this disease, you don't want to participate in any physical activity that might make it rupture.
Okay.
Typically, the signs and symptoms will last about 2 to 4 weeks. However, they can last for a month or up to 6 months.
Wow.
Yes. So, and also with the fatigue, it might be very hard to complete like everyday activities. There can also be nausea and vomiting, loss of appetite, a headache, sore throat, like I said, and chills. So the symptoms a lot of times can be very similar to that of strep throat. So
Okay.
a lot of times they'll do a strep throat test too to rule that out.
Okay. And what are some ways that we can prevent mono?
Well, like I said earlier, mononucleosis is spread through bodily fluids and oral secretions such as kissing, sharing drinks, sharing utensils, blood, sexual contact. And so it's important to prevent that by not doing these things. So not sharing drinks and not sharing utensils. Avoid sharing toothbrushes with friends or family and things like that.
Okay. And treatment-wise, what are the options?
Typically, treatment focuses on the symptoms.
Okay.
So like fever, headache, and the sore throat can be treated with medications such as Tylenol or ibuprofen.
Okay.
Sometimes corticosteroids are used to treat the sore or the swollen throat, swollen lymph nodes, but that's not a long-term treatment.
Okay.
And if there is a bacterial infection present along with this, such as strep throat, we will use antibiotics as well.
Okay.
But that's only used if there's a bacterial thing involved, because mononucleosis is a virus and it cannot be treated with antibiotics.
Okay. Is there any kind of vaccine for mono that parents can get their children immunized against?
Currently, there is no vaccine available, which is why it's so important to prevent it. So again, avoiding that transmission. It's important that we're staying hydrated, maintaining a healthy diet, getting adequate rest, and just keeping ourselves healthy. That way we do not contract mononucleosis.
Okay. Are there any other things that you think are very pertinent to mono that parents should be on the lookout for?
I just think it's very important to touch on how with the spleen it can rupture. So really wanting to avoid any contact sports if the child does have mononucleosis for about 2 weeks, because with that rupture there can be bleeding and this can be very life-threatening and result in an emergency surgery. So that's something very important to keep in mind. Rest, rest, rest.
Okay. And is this pamphlet going to be available?
Yes, so we will upload this pamphlet to the Channel 5 News website so that it's available to the community. You can download it and read up on it so that you're on the lookout for it.
Absolutely.
Well,
Camera
thank you
guy has a
guys
question.
So much.
Yes.
When should parents take their children to the doctor with mono? At what point do they realize, oh, kid needs to see the doctor?
Yeah, so if their child is just not feeling well and they're acting more tired than usual, I would say that's a good idea to go ahead and just take them into their physician and just see what's going on, and they can ask them more questions and see if they're dealing with any other symptoms that line up with mono, because you don't want to wait too long before it gets too bad. You want to prevent it and you want to get it treated as early as possible. So sooner rather than later would be great.
Alrighty. Thank you guys so much.
Thank you for
Thank
having
you.
us.
Thank you.
Alrighty, everybody wave bye. It's just so she can see our faces.